Welcome to Eye on Innovation, brought to you by the OIS podcast. I'm your host, Carey Powers, and today our topic is innovations in corneal cross-linking technology. My expert guest today is Dr. Deepinder Dhaliwal, professor of ophthalmology at the University of Pittsburgh School of Medicine and director of refractive surgery at the UPMC Vision Institute. She's also president-elect of the International Society of Refractive Surgery and president-elect of the Cornea Society. Dr. Dhaliwal was an investigator in the original clinical trials leading to the first cross-linking technology approved in the US in 2016 and continues to serve as an investigator for new cross-linking technology as well. So welcome to the OIS podcast, Dr. Dhaliwal.
Thank you so much, Carey. What an honor to be here today.
We appreciate you taking time out of your busy schedule here at Arvo in beautiful Seattle to spend time with us to talk about cross-linking. So I think it makes sense to start at the beginning and talk about the prevalence of keratoconus. So how has our understanding of the prevalence of keratoconus evolved over time?
You know, Carey, that is such a great question. And with better diagnostic imaging, our prevalence data is actually showing that the prevalence of keratoconus is more like 1.2%. And that comes from the RAIN study that was done in Western Australia and published in Ophthalmology in 2021. And they looked at a cohort of patients, over 1,000 patients, and the incidence there was 1.2%. And that's in 20-year-olds. So we are really now discovering that the number is so much higher than we thought it was. You know, 1 in 84 people age 20 have keratoconus. So it's something that I think that we were waiting, until there was severe vision loss to make that diagnosis, and now we can make it much earlier. So it's a high percentage.
So tell us about the standard of care today for these patients.
You know, it really depends on age and whether there is progression of disease. But in the US, we are able to do cross-linking on a patient who is progressing. We have to document progression of disease, and that is the FDA requirement. So we have to show either through refraction or keratometry that there is, or thickness of the cornea, that there is actually worsening disease, and then we are able to do an epithelium-off cross-linking procedure, which is the original Dresden protocol, and that takes a bit of time. We don't have an accelerated type of cross-linking such as available in other parts of the world.
So what are the unmet needs that you're seeing in your clinical practice that are driving innovation in cross-linking?
Yeah, I wish we had a safer, faster cross-linking procedure that had lower risk. So when I talk to a patient, I tell them we have to remove your epithelium for 8 to 9 millimeters, and then we soak the cornea with riboflavin, and then we have the light for 30 minutes, and it is a very long process for them. We treat one eye at a time. So then the recovery, as you can imagine when you have a big epithelial defect, is prolonged. So, they have to take time off work, they can't really just jump back into life. So what we want is something where the risks are lower, there's less discomfort from the procedure, and faster recovery back to daily life.
Okay, so looking out on the horizon, what do we have coming down, hopefully, in terms of new technology that could help these patients and meet those needs?
Well, I'm really excited that we will have, and we are investigating, an epithelium-on cross-linking procedure. I think that's going to be actually game-changing. We are able to treat patients who are diagnosed with keratoconus. We do not have to show progression in the study, and this is a trial run by Epion, and they just need a diagnosis of keratoconus, and then we can treat. And it's just, we don't have to remove the epithelium. We just, kind of brush the epithelium, and it stays intact, and so the recovery is so much quicker with much less side effect profile.
What other advancements are you seeing?
Well, I have to say, scleral contact lenses, they have really changed the game as well in terms of optics. There's so many exciting things with custom type of cross-linking procedures. I have to say Farhad Hafezi and his group in Switzerland are doing amazing work in terms of the next kind of generation of cross-linking with kind of a customized treatment where they just remove the epithelium right over the cone, and then they're able to treat. They can treat even very thin corneas because they can adjust the fluence and energy delivery. And so even very, very thin corneas can become stabilized with cross-linking. So I'm excited about the future, about all these innovations.
It's great to hear that some more promising treatments are on the horizon. So as you think about identification and screening, do you think that there'll be a point that technology advances so that we can identify these patients earlier?
Another great question. Actually, we have that technology, and it's corneal tomography. So when we look at a corneal tomography, we can really detect keratoconus because the subtle changes on the posterior cornea are detectable. The problem is that it's not low cost. It's not low cost technology, and it's not available to pediatricians and all eye care professionals. So I would love for there to be a device that's easily accessible for patients in optometry offices, ophthalmology offices, and pediatrician offices, maybe school screening. What we really need to do is, just like we do vision kind of screening at certain ages, we really should be detecting keratoconus in our children at an earlier time point, and we really need to intervene before they have significant vision loss. I mean, this is a disease that if we kind of stop it in its tracks, this child will have a much brighter future with much better vision for a lifetime. So it's really exciting. I mean, of course, cross-linking doesn't work forever, but at least it'll stabilize their cornea for 6 to 7 years, and then it might need to be repeated, but we have to intervene early. We just cannot wait with the current paradigm of waiting for progression and waiting for further vision loss.
How do you think that artificial intelligence might play a role in helping to identify these patients sooner?
Yes, it absolutely has a role. And they're actually coupling AI with even corneal topography to see if we can detect changes, but definitely with tomography as well. We need to use technology to try to help practitioners and even parents, try to figure out if their child has keratoconus or not and intervene at an earlier time point.
Very good. Well, thank you so much for sharing your insights with us today. Listeners and viewers, thank you for tuning in to the OIS podcast. If you've got ideas for future topics for the OIS podcast to explore, email us at ois@healthagy.net. Thank you, Dr. Dhaliwal.
Thank you, Carey Powers. I had a great time.